This presentation is titled A New Piriformis Stretch, and this is a stretch I've been doing for many years, and I was pleased when the main author of this paper contacted me and shared his research with me, and I'm sure that I would destroy his name. So this is from the Netherlands, and so I'll let you read the author's name, and that's the title. And using just a few keywords would get you to that article. And I pulled this off of www.pubmed, P-U-B-M-E-D, and that's the scientific journal that it's published in. And this study showed that at 110 degrees of hip flexion, the piriformis muscle is primarily a hip abductor. And so the ideal stretching position would be 110 degrees of hip flexion and stretching it in adduction. And I will show you how to do that. And this is just a brief reminder of the piriformis muscle. And it comes from the front of the sacrum. And in my left hand is the sacrum here. And here is that piriformis muscle coming at an angle and attaching pretty close to the top of the trochanter of the hip. And I'm going to place a skeletal model here so that I can accurately capture the angles in demonstrating the piriformis stretch. Now, if we take into consideration that different people have different types of anatomy, and so the shapes of their pelvis and hip and piriformis muscle might be slightly different, and for that reason, I think that it is ideal to actually stretch the piriformis with at least 3 different angles. So let me adjust my camera. And I'm so fortunate to have the skeletal model. It was a bit expensive, but it's a very flexible one. So in this skeletal model, we're going to demonstrate stretching of the right piriformis, and of course we're stretching the other hip rotators that are proximal to the piriformis. So here we have the hip flexed at a 90-degree angle, so the femur is pointing straight up. And what we do then is stretch it, reaching across, and the person can use either hand and push the thigh to the left. And I recommend a very gentle engagement of the hip musculature, and I recommend that they maintain this force, setting a timer for 2 minutes or even as much as 5 minutes. And I encourage them to do it twice a day for a week, and at least twice a week thereafter. So that's the 90-degree angle, and then we could have them flex their hip up a little bit higher, approaching that 110-degree angle that the author spoke about, and then again capturing the thigh with the hand and pushing it across to the left side of the body. So then we can come back to a neutral, a 90-degree angle, and then drop it down a little bit, and we're approaching a 75-degree angle, and repeat the same stretch. So I'm going to move the skeleton off the table, and then I will demonstrate with my own hip what that looks like. And as you might be able to tell, I'm the cameraman today. All right, so I'm not going to be able to reproduce a perfect angle, but I think this is 90. I hope this is very close to 90. So I could reach over with one hand, grab the hip, bring it over to the left, and maintain a very gentle, steady force for at least 2 minutes. And then coming out of it slowly, bringing the hip up a little bit further, and then the same drill, stretching it over to the left, doing that for 2 minutes, coming back to the 90-degree angle, and then dropping it down a little bit, about 15 degrees or so, and repeating the stretch. And you'll notice perhaps that my left knee is bent, and I don't think it really matters. I don't notice any particular difference in the feel of the stretch, so I would use whichever is comfortable. And this is brought to you by the Hesch Institute, and that's spelled H-E-S like Sam, C-H. And we are in Aurora, Colorado, and our website is www.HES like Sam, C-H, institute.com. Thank you very much.